Good morning and welcome to your Weekend Healthy Chat. I'm your host, Dr. Sara. Today we have a special guest who comes to us from the MilfordMD Cosmetic, Dermatology, Surgery, and Laser Center located in Milford, PA, Dr. Marina Buckley. Welcome.
Thank you, Dr. Sara. Thank you very much for inviting me. It's such a great timing because May is a Skin Cancer Awareness Month, so I'm really happy to be on your program to talk about this very important issue.
Good. Well, we're very happy to have you, and we're going to discuss skincare issues for summer and beyond. So to start off, since it's been such nice weather out and you can tell that summer is approaching, there are a lot of products out there for sun protection, some that actually work. So what kind of products do you recommend?
I always recommend to my patients to use sunblock every single day. And we certainly recommend using a sunblock with SPF 30 or higher. And it should be broad spectrum sunblock that would cover UVA and UVB light. So it needs to say broad spectrum on the bottle. So that is a must in my book. And it should be used every single day, whether it's a cloudy day, rainy day, or even a snowy day, one should use a sunblock.
And at what ages do you recommend people starting sunblock? I get that question all the time in the office, especially now when the nice weather has approached.
I recommend from age 6 months to 104. I think maybe after 104 you can start giving up, but before that you should still continue using sunblock.
Are there certain types of sunblock you recommend over others?
I recommend people to use SPF 30, and I prefer physical sunblock rather than chemical sunblock, meaning that the sunblock that has titanium and or zinc in it, as it is offering more broad spectrum coverage than some of the other chemical blocks. But there are some very good chemical blocks that are just more irritating to the skin in some people.
What about the sunblock sprays versus the actual lotion? Is there a difference?
I prefer the lotion or the cream.
So really to lather
So that's right. Yeah. But however, if you have a child that is very hard to
sit still for even 2 seconds,
then,
yes.
Then sun spray would work. That would work well. Or I think for your hair, on the hair part, or just scalp in general, the spray would work well as well. It's just that there is no good evidence of consistent protection from the sprays.
How often do you advise someone to put sunscreen on? Is it every 30 minutes, every hour if you're out in the sun? Does it matter?
We advise to reapply sunblock every 2 hours. However, if you're swimming or you sweating a lot, then that should be reapplied, maybe even more frequently than every 2 hours. That's important. You can also check the bottle. It will tell you how frequently the sun protection should be reapplied. Some say 40 minutes, some say 80 minutes, but as long as you do it every 2 hours, that's good enough in my book.
So I know you recommended SPF 30 or higher. What do you think about I know there's a lot of controversy out there about whether it's effective once it's above 70. And my husband wears 110 as he is a very pale Irish guy. So is 110 even useful, or is it once you hit 70 SPF-wise, it doesn't matter?
SPF sunblock covers 97% of UVB rays. SPF, by the way, is just the measurement of UVB. It doesn't tell you if the sunblock is protective against UVA. Going to SPF 45 only increases the coverage by 1%. So truly, statistically, you are not improving so much after SPF 30. So I always tell my patients, get something with at least 30. If you want to...
So the 110 might not be that useful, huh?
That's right.
So I can tell him I'm right?
Exactly, always.
Of course.
But as long as he's using, I think the main point that he is using, and that's great.
Now, what do you recommend for kids? Do you still say the SPF 30? Because I know Neutrogena and a lot of different products out there for kids, they recommend 50 and 60. Is that fine, or would you still say 30 is okay?
I still say the same thing. It's the important fact is that it needs to be reapplied, especially with kids in the summer when they're swimming and playing sports. It's very important to reapply sun protection, and also have a fresh sunblock, not something that expired 5 years ago.
Yes, that is definitely key, which we found out the hard way. Now, are umbrellas effective?
Umbrellas are very effective. It's no wonder that Asian countries use umbrellas quite a bit. There's a whole culture in Asia of having as light skin as possible and protecting the skin from the sun damage. So they use umbrellas every single day out in the sun. So it's not protection that's 100%, but it will improve your sun protection.
Okay. Now, I know you said 6 months and older is when you recommend the SPF 30. What do you do for children who are under 6 months?
Well, I think we should ask you about that, since you are the pediatrician.
But do you ever get that question? Because in my office, we usually say just to keep them as covered as possible.
Coverage with clothing, of course, yes. And certainly not
try to
putting
avoid
them in
it
an
as
open
much as-
sun. That's
Exactly.
right, because their baby skin is so sensitive. You really don't want them to be in the open sunshine at that age.
I think one of the things that may surprise people is that sunblock is not just for the summer. It really should be an all-year thing. Can you explain what that means?
Sure. You get sun damage from UVA and UVB light, and that's present all year round, especially UVA light. And that's why we recommend our patients to apply sunblock every single day, even if they're not going outside but sitting by sunny window. They should be using the sunblock because UVA goes through the window and through the windshield of your car. So that's very, very important. In fact, most of the Americans get sun damage while driving a car.
Oh, really?
That's statistics.
Wow. How long does it take to get actual sun damage, whether you're at the beach, whether you're taking a walk, or just commuting to work? How long does it take?
It doesn't take much. That's just a matter of minutes of exposure. And that's why even for people who's just going to the mailbox, it's important to wear the sun protection. And that includes sunblock, a hat with a wide brim, and sunglasses. If you can put protective clothing, a long-sleeve shirt, that would be also good.
Okay. What are some of the signs of sun damage?
Well, we see a lot of that in the office. The sun is a known carcinogen, so we see thousands of people with skin cancer, and so that's, of course, the main concern. But we also see people with brown spots, red spots, enlarged capillaries, telangiectasias, loss of elasticity of the skin. That's all a result of sun damage. Sun breaks the DNA of the skin cells, and that's what creates the aging effect on the skin.
Okay, perfect. Well, let's take a quick break, and we'll be right back with Dr. Buckley. Thank you.
Thank you.
Welcome back. We're here with Dr. Marina Buckley, and we were just talking about sun damage and skin damage. And so what are some of the types of clothing that you recommend for being out in the sun?
Well, I do recommend everybody to wear a hat with a big brim, maybe at least 3 inches would be good, and sunglasses, or not clothing, but sunglasses, and shirt with a long sleeves and long pants, and sunblock to cover unprotected areas. The areas that are exposed to the sun need to be covered with sunblock.
Does it matter if the clothes are light or dark in color?
The dark ones considered to be better protective.
Now, why is that?
I think they're mostly tighter woven, so that's part of the trick, and absorbs the sun rays better, not letting them go through.
Great. Well, what are some of the problems that you see commonly in the office?
We see lots of patients with severe sun damage. spots, brown spots, irregular pigmentation. We see a lot of people with rosacea, which is a disease that can be hereditary, but also is triggered by the sun.
What is rosacea?
Rosacea is a skin condition that develops usually later on, and mainly in people with a lighter skin, that presents with redness, some papules, little bumps, red bumps. It also, you can see telangiectasias, which are capillaries on the skin, enlarged blood vessels, and it usually presents on cheeks, nose, chin. Sometimes rosacea can also present with those large noses, as it's seen some men. It's called rhinophima, and that's also part of rosacea.
Okay. And those you'd say were the more common things you see in the office on a day-to-day basis?
Yes, those are the most common. Skin cancers, we treat a lot of skin cancers, thousands of skin cancers in the last few years. In general, the rate of melanoma and non-melanomatous skin cancers are increasing in this country. And that's, melanoma is the most common skin cancer in young adults.
What does melanoma look like?
Well, usually it presents as a very dark, unusually dark spot, and we look for clues. It usually looks different than the rest of your freckles or spots. It can have irregular pigment, irregular color to it, and the size is usually also it's not symmetrical. So those are the signs that we look for.
Now, is it curable?
It can be curable if it's caught in early stages, but it can also metastasize and kill people. So that's a very nasty cancer to have.
Can it be prevented?
In some instances, yes. Some melanomas are related to sun exposure, so preventing sun damage is important. Some other melanomas are hereditary. And
for people with hereditary melanomas, what do you recommend that they do as a way to prevent it from spreading or from becoming cancerous?
Well, we always recommend a very strict sun protection. Also, American Academy of Dermatology recommends checking your birth suit on your birthday. So look, evaluate, see if there are any new spots that are developing that are unusual for you. Go to see your dermatologist. Have your skin evaluations on a regular basis. That would be very important.
So if you're someone who's covered with moles or with dark spots, how often do you recommend they see a dermatologist?
I would recommend once a year for a good total skin evaluation.
Okay, and what does that entail?
We usually ask people to get fully undressed, including socks and everything else, so that the largest organ in your body, which is skin, is fully exposed. And we examine head to toe. It's scalp, it's between your toes, it's every inch of the skin is being seen. And the physician then evaluates for suspicious lesions or other problems.
And how do you evaluate for suspicious lesions? What do you do?
We have a special tool that's called dermatoscope. It's like a handheld microscope that we evaluate the lesions with. If we need further diagnosis, we do skin biopsies.
And you can do that right in the office?
And we can do that right in the office.
Okay, great. I always have parents who come in with their little ones that ask, at what age, especially little ones who have either birthmarks or whether they have moles or dark spots, and they ask what age they should start going to a dermatologist. What do you recommend? I
think pediatrician is a very good, pediatric office is a very good place to start. And I think if your pediatrician recommends that a spot needs to be checked or the way this child's skin is looking suspicious, then it should be checked. I don't think there is any particular age at which a child should be seen by a dermatologist.
Okay. And what are some of the ways you treat skin disease, from even the simplest form of skin damage to the more serious stuff that we've been talking about?
Well, sun damage can be treated cosmetically, and we do that using lasers. Laser technology is very important in treating nowadays all forms of sun damage. We'll also use photodynamic therapy. in the office for sun damage and also early skin cancers.
What's that?
That's a special treatment when we apply a photosynthesizer. It's called aminolevulinic acid.
Mm-hmm.
And we then let this medicine soak into the skin for a prescribed period of time, after which we expose the skin to a special rays of light, either blue or red, to activate the medication. And that helps to treat early skin cancers, precancerous skin condition, photo damage, and we'll even treat acne with that method as well.
I definitely have a lot of teenagers who would be interested in that, especially with acne.
Yes.
Is acne a hot topic that you see in the office commonly?
Very much so, yes. We see a lot of patients with acne. I love to deal with them. It's
what are the first line? What are the first line treatments you recommend for acne?
We usually start with local preparation. We use medications, retin A-like medications, so vitamin A derivatives are very important to incorporate. Occasionally we use antibiotics, oral antibiotics, and other treatments as well.
Okay. All right.
We also have a blue light, which we use for acne, and we use some lasers as well, such as V-beam or other lasers.
Do you have a lot of teenagers who receive that treatment?
We do. We do.
Okay, great. So before we wrap it up, what are some of the tips that you have to keep the skin healthy throughout the year, not just the summertime?
Use your sunblock every single day, all through the year.
So even in the wintertime, it doesn't matter?
Even in the wintertime, yes. I always have sunblock on my face when I go to the office. I'm in and out of the car, and that's all the exposure that I get in the wintertime, and I still have a sunblock on. Use good moisturizer. That's important for everybody.
Mm-hmm.
Wash your face with a gentle face wash that's specifically for the face, not just an ivory soap bar. If you're concerned about aging, photoaging, start using a mild form of retinoids, such as retin A or similar medication that can be prescribed, or you can start with the retinol that can be purchased over the counter as well.
Okay, great. So how does someone reach you for a consult?
Well, our office is in Milford, Pennsylvania. You can certainly call 570-296-4000 to make an appointment.
And for our listeners, is there a website that they can check out to find further information?
Yes, we have a ton of information on our website. That's MilfordMD.com, all small letters.
Okay, perfect. Well, I just want to thank you for being here today. We appreciate it. And we'll be right back after this.
Thank you, Dr. Sara.
Welcome back. Let's take an email question. Today's question comes to us from a Westfall parent, and they write, what is the normal age range when potty training should be completed, and do you have any tips to make the process as smooth as possible with the minimum stress for both the parent and the child? That's a great question. So what we say is to have it completed between the ages of 3.5 and 4. But granted, there's a huge age range when it comes to potty training. Some children start as early as 18 months, and some don't start till they're closer to 4. And what the key that you're looking for is just to see when the child is ready to be potty trained, not when the parents want them to be ready. So I have some kids in my practice who at 18 months are taking their diaper off or interested in the potty, want to potty train. And I have some 3.5-year-olds who still show no desire. But the key is, as the parent, not stressing about the child not wanting to potty train. Let them come to you. And really, once they start showing that interest, start with a sticker chart, start with little prizes just to really increase the amount that they're using the potty. And after a few months, it's really going to come down to them being more interested and not wanting to feel that sensation of having just gone into their diaper. So with these couple of tricks, that should make the transition very smooth for both you as well as the child. But like I said, the key is not to put undue stress on it. Accidents are going to happen. I have a 3.5-year-old and accidents still happen, and that's just one of the things to be expected. But really, as the closer they get to 4, the more they're going to want to potty train, not want to have that wet sensation or that dirty sensation, and therefore they'll pick it up much easier. I hope this helps. For any parent out there with young children, either looking to potty train or any parent who has a question about what we were discussing today regarding sun damage and skin damage in general, please feel free to see us. We're located at the Port Jervis Center for Primary Care, which is at 140 Hammond Street, Port Jervis, New York. I just want to thank our guest today, Dr. Marina Buckley, for being here with us, so thank you. And as always, have a healthy and active week ahead. Thank you for tuning in, and we'll see you again next week.